The thyroid gland, very, very important gland, lies in the neck, somewhere here, just below the larynx, which is the voice box. So this gland produces hormone called thyroxine, and I'll not go too much into the details of that, but this hormone is vitally important in the normal functioning of any human being. And you can have overproduction of the thyroid hormone or underproduction, and these are treated usually medically. What also can happen is over time, parts or all of the thyroid gland can become large and become visible as a swelling in the neck. And that can be disturbing and uncomfortable for the patient and can even produce symptoms because it presses down on the all the delicate structures which lie in the neck, like say the trachea from which you breathe, or the voice box, areas like that. Usually the treatment of such a swelling of the thyroid gland was only possible surgically. That means you cut open the neck, you remove part or all of the thyroid gland, and that could give you relief from that swelling. However, in many cases, especially if all of the thyroid gland needs to be removed, there is a problem because the hormone then needs to be replaced, and that would mean lifelong medication as a replacement. Swellings in the thyroid gland can be both benign and malignant. That means they can be because of a cancer of the thyroid or something which is not a cancer. All the things which are cancerous have to be treated according to their stage and their diagnosis, mostly by either radioactive iodine therapy or by surgery, or depending on the stage by chemotherapy, etc. However, when the growth is not a cancer, do we have good options for treating these patients? I'm happy to say that through interventional radiology procedures, we can treat many of these patients by very simple procedures, give them relief from their symptoms or their cosmetic deformity in a daycare procedure. So what are these? If you have a swelling of the thyroid, which is because of a non-cancerous nodule enlarged, we can do something called ablation. What is ablation? Ablation is a technique in which we place a needle or a probe into the nodule, the thyroid, and we raise its temperature to a point where all the cells there get killed. This temperature is somewhere between around 70-80 degrees centigrade. We don't want to raise the temperature too much. We don't want to have the temperature too low, so obviously there are mechanisms for strictly controlling this temperature. There are many techniques by which we can raise this temperature locally or ablate nodules in the thyroid. These include RF ablation, which is using a very high intensity alternating current. It includes microwave, similar to microwaves like you find in microwave ovens, where we use a probe which is called an antenna to raise the temperature locally. We can also use a technique known as cryoablation, where we freeze the nodule. Basically, with all these techniques, we kill the nodule without cutting it open. And over the subsequent 3 to 6 months, the nodule shrinks down and becomes invisible, and the symptoms of that nodule go away. What are the problems with this procedure? Well, I'm often asked as to what the complications can be. To be very frank, we have not seen too many complications with these procedures. The only feared complications of these procedures are nerve damage, which is there are many nerves running through the neck, and if you raise the temperature of the nerve and damage it, the nerve will not function properly. And the commonest of these nerves which can get affected is something called the recurrent laryngeal nerve, which runs right next to the thyroid gland, and it supplies the vocal cords. So if a recurrent laryngeal nerve is damaged, you lose the quality of voice, you can have a hoarse voice, it can become difficult to talk, etc. How do we avoid that? We avoid that by making sure that our ablation zone does not include any such structure. We can do this by many ways, and the commonest of this is something called hydrodissection. We inject cold fluid into the area between the thyroid gland and these vital neurological structures and push them away from the thyroid gland and the ablation zone so that they do not get damaged. To do all this, we use generally an ultrasound guided system, a procedure by we can see the nodule, the target, and the structures we want to avoid very, very clearly. And that is what makes these procedures so efficient, easy, and attractive. The fact that they are minimally invasive, we make a hole of 1 millimeter or 2 millimeters, treat the nodule, the patient is awake throughout, the risk to the patient minimal, and the patient can go back home same day. So thyroid ablation is an excellent solution for nodules of the thyroid causing deformity or symptoms which are not cancer and which are up to 5 centimeter in size. But as I said earlier, some people have enlargement of the entire thyroid gland, and sometimes this enlargement can extend downwards into the chest. Can we ablate these cases too? No, we can't, because it's too big for ablation. What can we do in such cases? What we can do in this situation is, as I said about other organs, we can do something called embolization. Embolization is when we put tiny particles into blood vessels to block them and thereby reduce the blood supply of some part. So the arteries supplying the thyroid, we can select how much of the thyroid we want to shrink, and thereby there are about 4 major arteries supplying the thyroid, and we can block some or all of them partially or completely, and thereby shrink the thyroid down to a point where it is no longer unsightly or causing problems to the patient. And this again is a minimally invasive procedure. Daycare procedure, does not involve any severe pain or discomfort or general anesthesia. So for any non-cancerous enlargement of the thyroid, we have excellent solutions through the techniques of interventional radiology.